Hello friends, today we're going to discuss about World Mental Health Day 2022. I'm Dr. Suresh Badadmat, Professor of Psychiatry working at NIMANS, Bangalore. Every year on 10th of October, we celebrate this World Mental Health Day. This is celebrated across the globe. This year's theme for World Mental Health Day is making mental health and well-being for all a global priority. The objective of this World Mental Health Day is to raise awareness and mobilize support for mental health issues. And also, this day provides an opportunity for all stakeholders to make awareness regarding stigma and discrimination associated with mental illness. Given the recent experience of COVID pandemic, it is expected that the need for mental health and psychosocial support will increase substantially in coming months and years. Hence, this year campaign being making mental health and well-being for all a global priority. Let's understand this theme. Here in this theme, there are two important terms, mental health and well-being. Both these terms are very difficult to define, but it is very essential to reach that target. But let's understand this two important terms, mental health and well-being, both are there in this year's theme. Let's understand about health first. As per WHO, health is a complete physical, mental, and social well-being, not merely the absence of illness. Again, there is a word well-being. If you look at the definition of mental health, as per WHO, it also states that it is a state of mental well-being that enables the people to cope with stress of life, realize their ability, learn well and work well, and contribute to their community. Again, it is very difficult to operationalize, but however, the definition is very comprehensive. Now let's understand this well-being. Well-being refers to optimal functioning and experience. Again, it is very comprehensive and difficult to operationalize. If you look at the well-being definition, it revolves around two distinct related philosophies. One is hedonism and another one is eudaimonism. If you look at both of them, hedonism is subjective. It revolves around the experience of pleasure and avoiding pain. Whereas eudaimonism is objective and the realization of one's true potential and the experience of purpose of meaning of life. Here the objectivity plays an important role. So, to understand, hedonism is more of pleasure, avoiding pain from the well-being perspective. Whereas from the eudaimonism, the objectivity prevails. Here, one's true potential realization and experiencing of having a purpose in life. It is a larger purpose which talks about. Now, let's understand this both concept of mental health issue pre-COVID era. That means before COVID, what was the mental health status in India? If you look at this issue of mental health in India, there was an important study conducted by Ministry of Health and Family Welfare in 2015 and 2016. This study was called as National Mental Health Survey. As per this survey, if you look at the results, it is 10% of the population in a given point of time has mental illness and they require professional support. If you take the population of India is 140 crore, 10% means 14 crore population requires help. In that, 0.8% is severely mentally ill, that is approximately 1 crore population. If you look at this triangle, the population of 140 crore, the well-being is the base of the pyramid. That means these are the people who need to have a good lifestyle so that their quality of life improves. They do yoga, they are active, and their well-being is there. Moving further up the base of the pyramid, it is worried and distressed. Here, the people will have invariably stress, economic loss, family problems, interpersonal problem. These are the people who require help from one or the other methodology. The high risk population, that is, family history of mental illness, substance use, disaster survivor, chronic medical conditions are those people who are at high risk of developing mental illness. And the above is common mental disorders, and the tip of the pyramid is severe mental disorder. Let's understand how we should provide care. The first and the foremost is community care. From the bottom of the pyramid to the tip of the pyramid, community care is very essential. And further, the individual care, that is, to have a good quality of life, that is well being, one need to do certain things to keep their mind and physical health active. Further, with regard to worried and stressed, peer support becomes very essential. With regard to high risk, common mental disorder, severe mental disorders, professional help becomes very essential. But however, if it is a severe mental disorder, then the hospital, that is mental hospital, care becomes essential. This is how we need to plan services, especially in a developing country like India. And we look into the another important study, that is National Survey on Extent and Pattern of Substance Use in India. This study was done in 2019 by the Ministry of Social Justice and Empowerment. So, the title of the study is Magnitude of Substance Use in India 2019. If you look at the alcohol, 2.9 crore people are dependent on alcohol. That means 2.9 crore are addicted to alcohol. The addiction is the word used by lay term, but in medical term we call it as dependence. 2.9 crore people, if they are dependent, that means 2.9 crore families are suffering because of alcohol abuse by a person or dependent by a person in the family. If you look at the cannabis, 25 lakh are dependent, that is addicted on cannabis. Similarly, opioid, 28 lakh people are dependent or addicted to opioid. Other drugs, the people who are addicted or dependent are 10 lakh cocaine, 18 lakhs amphetamine, 12 lakhs hallucinogens, 7 lakhs inhalant in children. Look at those numbers, 7 lakh. Children are addicted to volatile substance abuse. At the same time, pre-COVID era, we need to know about the suicide. As per National Crime Records Bureau, 2019 reported 1,39,123 death by suicide. And every day, 381 people death by suicide was reported. Into 20 is the attempted suicide. That means 27 lakh 82,460 people attempted and failed. That means at this point of time, suicide is a public health issue. Along with this, let's understand the morbidity of mental health, especially across the globe. If you look at the top 10 leading cause of global years lived with disability, out of this 10, two of them are psychiatric illness. One is depressive disorder, which is in the second ranking. The sixth one is anxiety disorders. See, number of years lived with disability is 5.6%, and in anxiety disorder is 3.4. However, if you look at the morbidity, globally, mental disorders account for 1 in 6 years lived with disability. Means for every 6 years, a person is living with mental illness, 1 year is spent in disability. At the same time, 12 billion work days are lost every year because of depression and anxiety. If it is 12 billion, think about a minimum wages per day and calculate it. It's a huge amount which is lost by the country, by the community, across the world. Let's look into the mortality, that is, the death. People with severe mental disorders or mental health condition die 10 to 20 years earlier to the general population. That means Mental health issues or psychiatric illness hastens the death. That means their life span decreases by 10 to 20 years. Till now, we discussed about mental health issues before COVID. Now let's discuss about mental health and psychiatric issues during COVID and post COVID and how to deal them. In the post COVID, there is no health without mental health. That means if you want to have an optimal health, there should be a good mental health. Adversity, such as COVID, lockdown, economic loss, such adversities is one of the most influential and detrimental risk factor for mental health. If you look at the impact of pandemic, death of a family member, long COVID cases, loss of livelihood, displacement, disruption in academic activities, especially in children, in adolescents, climate change, war, refugee status, economic crisis. All these are the breeding ground for mental illness. This diagram clearly talks about the relationship between poverty and mental illness. Whenever there is a poverty, there is a poor education, domestic violence in the family, unemployment. Because of this, it will cause stress, and stress will relate to substance use, maybe alcohol, maybe nicotine, cannabis, and this leads to mental illness. Further, there is a risk taking behavior, poor parenting because there is mental illness, and further, poor education, and this continues. This is an endless vicious cycle. One need to break this. To break this cycle, we need to treat a person with mental illness and make sure his social well being and his economic status is improved. Let's look into the post COVID illnesses with regard to mental illness across the globe. Rates have already been depicted by WHO, telling that depression and anxiety have increased by 25% across the globe during the pandemic and post pandemic period. Further, deaths in suicide also been as noted. In 2020, there was a 10% increase in death by suicide. In India, 418 people died by suicide on an average daily. At the same time, total number of death by suicide is 1,53,052 number of people death by suicide was noted by National Crime Records Bureau. All over the world, mental health needs are high. Psychosocial support as requirement is very high, but responses are insufficient and inadequate. On an average, across the globe, both in developed countries, developing countries, and underdeveloped countries, most of the countries dedicate less than 2% of the health budget for the mental health care. Scaling up of treatment for depression and anxiety provides benefit cost ratio of 5 to 1. Indirectly, I would rather put it like this: just by treating depression and anxiety disorder, by investing 1 rupee, you'll be getting back 5 rupees. Think about all psychiatric disorder. That means there is a return on investment is 5 times. Hence, if you don't treat a person with mental illness in the society, the economic consequences of mental health conditions are enormous, not only to the person, family, to the society, and to the entire nation. Let's understand what are the gaps in this current mental health care, both in developing countries and in developed countries. The first and the foremost is gaps in mental health care. That means number of people who have been diagnosed as mental illness are on medication or on treatment. National Mental Health Survey of 2015 and 16 clearly depicted the number of people who are not on treatment varied from 70 to 86%. That means 70% of them are not on treatment who have been diagnosed as mental illness. It's a serious issue which needs to be addressed. Further, there is information gap. The incomplete data regarding the number of people on illness, number of people who are taking medication, what is the outcome if you do certain intervention, There is insufficient research. At the same time, we can also see governance gap, inadequate policies, inadequate plan, and aspirational laws. At the same time, misplaced priorities are causing more harm to our society. Further, resources gap. The budget investment on mental health is very, very less. Lack of availability of essential medicine, and also no mental health interventions at the workplace. Digital divide. That means in the rural area, the internet connectivity is very low. The people in the urban area, they are able to get the internet connection. Whereas in the rural area, the digital divide causes poor literacy and also access to health is a big challenge. Looking at the service gap, again, poor people find it very difficult to access treatment. Not only that, health insurance is many a time is not covered for persons with mental illness. Hence, there is a need for access to treatment across the country. At the same time, the access for the mental health care should be of sufficient quantity and good quality. With this, we move on to the investment in mental health care. There are three main reasons why we should invest in mental health. First and the foremost is public health, because, as I mentioned earlier, 10% of the population are suffering from mental illness. That means this, in a welfare state, the state should take responsibility for providing access to health care. At the same time, the person with mental illness, their human rights can be violated easily. Vis-a-vis, if a person's human rights are violated, he may develop depression or post-traumatic stress disorder or any other anxiety disorder. By investing in mental health, we can improve the socio-economic condition of the society and also enlarge across the nation. But however, we need to understand about the help-seeking behavior in mental health care. The factors that stop people from accessing or availing services are all important factors which stops them doing this. First and the foremost is access to mental health care is very poor. The people need to travel more than 50 to 70 kilometers to go for access for treatment. Non-availability of essential psychotropics, non-existent psychological, psychosocial treatment, low level of health literacy and awareness regarding mental health and psychiatric disorders, lack of insight. Further, stigma and discrimination comes in the way for access to treatment in any developing country. Further, we need to understand business as usual for mental health is not going to help. That means we need to take a proactive measures to provide mental health care within the community and at the doorsteps. The key areas which need to be implemented at this point of time, post-COVID, is governance. We need to have a good governance, advocacy regarding mental health, treatment for mental illness, psychological treatment, psychosocial issues to be addressed. At the same time, we need to have a good political commitment. The political commitment can be considered on three parameters. One is expressed. Expressed means, do we have a political parties passed any law? In India, Mental Health Care Act. Do we have any mental health policy? Yes, we have a mental health policy. That means in India, the political commitment with regard to expression is very good. How the question comes is finance. Are we investing adequately in mental health? At the same time, do we have institutions, human resources? Can we implement this Mental Health Care Act is a big question, especially in some of the states. At the same time, public awareness and also attempts to remove stigma and discrimination plays a very important role. Further, if the person with mental illness reaches a primary healthcare center, the competency of the primary healthcare doctor to diagnose and dispense medicines becomes very essential. To understand, my dear friend, everyone has a right to mental health care. Every person in this country has a right to mental health care. Hence, this is an opportunity to reshape the mental health services in the post-COVID. Whenever there is a disaster, it's a challenging situation, but it is an opportunity to revamp, reshape, and transform the mental health care in that area. Hence, following steps need to be taken immediately. First and the foremost is integrating mental health care along with the general health care. That means we need to provide mental health care either in the medical colleges or in the district hospitals, community health centers, and in primary healthcare centers. That means it should not be kept separate like in psychiatric hospital. It should be integrated with general health care. One need to invest in community mental health care. That means providing care at the doorsteps, improving the trained human resources for providing care in mental health, strengthening the informal mental health care such as awareness program, peer support program, school mental health program, or else even gatekeeper prevention of suicide program. And at this point of time, trained human resources with regard to mental health care is very poor. Hence, we need to adopt task sharing and task shifting, which have been found to be very useful in UK and US. Further, we need to understand mental health care is a complex interplay between individual factors such as genetics, family, community, and environmental factors. This complex interaction will lead to mental health issues at the same time with regard to well-being. If you need to provide and plan for mental health care, the base of the pyramid, as I told earlier, maximum people requires self-care and well-being. At the same time, next one is preventive and promotive actions to be taken, such as life skills training program, school training program, or else even the college mental health training program to be done at the college or school level. Community care is very essential. It is very essential because it prevents human rights violation. At the same time, the cost of providing community care is very, very less than the providing care in the hospital. Further, the important is general hospital care should be the priority. That means mental health care need to be integrated with general health care. And finally, the psychiatric hospital care, which is the tip of the pyramid, and only the fraction of the people do get support from the primary apex of this pyramid. The proactive measures to be taken. What are those proactive measures? Such as implementation of Mental Health Care Act, implementation of National Mental Health Program and Policy, Tele-Mental Health Program, which has been announced by our Honorable Finance Minister, need to be rolled out immediately. Task shifting and sharing should be the priority so that we can take mental health care to the doorstep. Trained human resources need to be addressed at the earliest. Please remember, mental health is everyone's business, not just yours or my business. It is every citizen's business. So this year theme, making mental health and well-being for all a global priority. That should be the considering the current scenario, situation in the post-pandemic. We need to have the priority right so that not even the last person is left behind. Thank you very much for giving your valuable time. Stay safe.